Dr. Larkin Carter is here to talk about mammograms today. He's a radiologist and has lots of information. So if you have questions, you can send them to the doctors at WLBT.com. Dr. Carter, thank you so much for being with us. Now, we know that there are lots of misinformation out there about mammograms. I've had one, and it's really not as bad as women think it is. How do you go ahead and get rid of those myths and the misconception that women have about it?
Well, it's real important, Maggie, for women to understand just how common this disease is. It affects 1 in 8 women in their lifetime. So I see it every day in my practice. There's not a day goes by that I don't deal with somebody who's had breast cancer, either newly diagnosed or has follow-up studies, including CT scans and PET scans. So it's just real important for women to understand that this disease, it affects 1 in 8 women, and there's really nothing we can do to stop that. There's no prevention for the disease. So the only thing we really have is early detection, and that's through mammography. And, you know, there's lots of, everybody hears lots of jokes on the internet about, it's hurting and things like that. But, generally it's not an uncomfortable examination, and it's very important for women to do, yearly starting at 40.
Right.
And it seems like that more and more women are having to get mammograms a little bit earlier than maybe their mothers or their grandmothers had to do that. So are we knowing more about this cancer or disease, or are we just being safe?
Sure. No, we're knowing a lot more. I mean, right now we're still encouraging all women to get mammograms yearly starting at age 40. There are certain women who need actually to get them starting at age 30. And mainly those women are those with a high, real strong family history. If they've had a direct relative who had breast cancer before the age of menopause, that's someone who needs to be more aggressive in when they start getting their mammograms, and we would recommend those women start at 30.
Now, I've been very open about the fact that I found the first lump when I was only 16 years old. It was not cancer, but I had to have surgery, and doctors recommended that I start getting mammograms about 25, and so I've been getting them every year, so I'm used to it. But I still hear women say, it's painful, oh, I don't want to do it, and I don't understand, because it's a preventive method to make sure that if there is a problem, doctors find it early.
Right. And the #1 reason we see for women who don't get mammograms is because nobody tells them to. It's, some women see their OBGYN every year, and they'll either order a mammogram or have it done in their office. And those women usually get their mammograms every year, but there's a lot of women who don't see a doctor every year. And it's, when you get in the car, you have a beeper that tells you to put your seat belts on. We used to have little machines that put them on for us. So, as people, we like it when people tell us what to do. And so, I like to make analogies to cars because most people are so safe about driving in cars and putting on their seat belts every time, yet some of these same people don't get mammograms. And a woman in the United States is 3 times as likely to die from breast cancer as she is from being in a car accident. So, yeah.
And another problem that we have here in the state of Mississippi is you have women who don't have insurance, and they don't go to the doctor or don't get a mammogram because they're afraid it's going to cost a lot. Can you tell me what places do, hospitals, clinics do for those to kind of relieve the fears of women out there who say, I can't afford this?
Well, the Baptist Breast Health Center does have programs for helping women out who can't afford to pay and don't have insurance. And there's a lot of foundations out there that aid in that. And oftentimes, October is Breast Cancer Awareness Month, and a lot of the places will have free screenings for certain numbers of women during that time.
So don't let cost keep you from doing this.
That's right.
Now, I was going to ask, as a radiologist, what do you look for when you actually examine the mammogram?
Well,
what is it that you're looking for?
It would be like if I asked Barbie, what would she look for if she went out and looked at the night sky? Barbie, what's the first thing you would look for?
I would look for it being clear, there being obstructions,
stars. And you would look for the moon.
I would look for the moon.
It's a big white ball.
Always there.
Okay, that's the first thing we look for on mammogram is just a white ball. That's how breast cancer usually looks, okay? And you see lots of stars out in the sky, and one thing we look for on mammograms, you may have heard of calcifications in the breast. Right. And they're little speckled things that look like stars, and if they're really closely grouped, like we see some stars, then we'll often recommend a biopsy because that can be a form of breast cancer that's developing the breast. Calcifications are usually benign in the breast, and they're very common. But with certain appearances, we would want to biopsy those. Okay. And you know, when it's clear outside, it's real easy to see the moon and the stars. But it's not always that way. Sometimes you have clouds and you can only see a little portion of the moon, or the stars are faint. And it's that way with mammography as well. Some women have dense breast tissue that kind of obscures things. It makes it difficult to see things. And that's where examination, clinical breast exams and self-examination are real important. And there's other modalities, ultrasound and MRI, to look for breast cancer in women who have very dense breasts.
Okay, well, we've got a question. It says, what are my chances of breast cancer if my mom has had it? Is it greater or less for this person? Well,
with any first-degree relative, it's a greater chance. It becomes more significant if their mom had it before the age of menopause. Because it's so common that a lot of people have moms and sisters with the history of breast cancer. But certainly that person's risk is up a little bit, but not as significant. It depends on the age that they get it. And some women have mutations, breast cancer mutations, that, you know, while the lifetime risk of an average woman, it may be 1 in 8, those women may be 1 in 5. And so those women, you'd need to be very aggressive as to how you screen them and image them.
But early detection makes all the difference, is
That's
that
right.
Okay.
That's right, because the way breast cancer acts is it starts small and it grows. And if we can catch it small, generally it has not had time to spread to the lymph nodes up under the arm. That's the first place that breast cancer spreads, is to the axillary lymph nodes. So our goal in mammography is to catch breast cancer when it's like this, and that's before you can feel it. And you know, if I find a breast cancer like that, I never, you know, I always really don't like telling people that they have a suspicious finding, but inside, I know that that's probably a victory for that woman, because she's probably going to get a cure, and you know, she'll have to have surgery and things like that. But it's those are the success stories. That's why we encourage women to get their screening mammograms, because if it gets as big as my thumb or as big as a ping pong ball, then those women they have a much greater chance of having spread to their lymph nodes, and a good number of those can be cured as well, but it's just a more extensive therapy. So.
And notice that he's wearing a pink tie.
Oh,
right.
I like that. I like that very much.
For breast cancer awareness.
Ladies, get out there and get those mammograms. Dr. Larkin Carter, thank you so much for being with us today. And of course, for the latest health news anytime, you can always visit our website at WLBT.com and click on Medical Matters.